Hi, Jason. My name is Julia.
Hi, Julia.
And I'll be your occupational therapist today.
Mm-hmm.
Have you heard of OT before?
No.
Okay, so OT help you get back to doing anything that you want to do in your day-to-day life. So for you today, we're focusing on vision because you need your eyes to do just about everything day-to-day, right?
Right.
All right. So I'm going to ask you a couple of questions. I know you recently had an accident where you hit your head. How are your eyes feeling today, and how is your head feeling?
Feels okay. My vision is still a little messed up.
Okay, and how so?
Blurry, not really seeing things out of my peripheral.
Okay, out of your peripheral vision.
Mm-hmm.
And then do you find that you fatigue at certain times of the day?
Yes.
Okay, after like certain activities?
Yes.
Like what?
Like jogging or moving
You're in a
around.
wheelchair.
Oh God. All right. After eating or going to the bathroom or going on a walk.
Okay.
Or going on a stroll.
Okay, and then when you bump into things in your wheelchair, I read in your chart that you have to kind of guide yourself in your wheelchair. Do you also find you bump into things, especially when they're on your left side?
Yes.
Okay, and do you it like things in your room or when you're going somewhere unfamiliar?
Usually going on somewhere unfamiliar.
Okay. All right, and then tell me about when you're watching hockey. I read in your chart that you fatigue when you watch the puck go back and forth. Is that still happening?
Yes, it is. It's quite tough to continue to, keep pace with the puck these days.
Yeah. So do you find like after just a few minutes of watching,
Yes, it's quite,
you need to take a break,
Yes.
lie down, close your eyes?
Absolutely.
Okay. All right. That's really a bummer because I know you really enjoy doing that.
Yes, I do.
Yeah, so one of the goals of these tests is I'm going to see exactly where your vision is lacking and how we can improve that.
Awesome.
And then I just have two more questions for you. Do you find that you have sensitivity to lights?
Yes.
Okay.
Mm-hmm.
All right, so mostly you need to like turn the lights off in your room or
Yes.
Okay. All right. And then are you able to read since your accident?
Not that great. It's still pretty blurry and it also strains my eyes a little bit, so I definitely do take breaks here and there.
You limit your reading?
I do limit my reading.
Okay. All right, so now we're going to run through a few eye tests, and if you need a break at all, just let me know and we'll quickly pause, okay?
Sounds good.
So this first test is to check your alignment,
Mm-hmm.
and I know you have sensitivity to light, but I actually do have to shine a light in your eyes for this test.
Okay.
So I'm going to dim these lights momentarily. And I'm just going to shine this light on the bridge of your nose. All right, very good. And we will turn these lights back up to normal and turn the flashlight off. Okay, so that test you did score normally.
Mm-hmm.
And now I'm going to check your alignment again, but this time I need to cover and uncover one of your eyes at a time. So you just continually look at me, and I'm just going to watch what your eyes do. Good. Good. All right. And next, we're going to check your fixation. So you're going to look at my finger for 10 seconds. I'll count for you. You just need to stare at my finger. And then we're going to have to test that in the middle and on both sides. And that's just to make sure that you're able to sustain that focus, okay?
Sounds good.
All right. All right, that was one. Now over here. Good. And now one last one. All right, that's all. That was your fixation test. You were able to maintain that fixation. And next, I'm going to check your range of motion of your eyes. So making sure that your eyes are able to move the appropriate distances both nasally, which is towards your nose, and then out towards your periphery. So this test, we do one eye at a time. So I'm going to have you cover whichever eye you'd like. All right, and you're going to follow my finger again. All right, very good. And now you can switch eyes. All right, Good job. And that test is done. You did have normal range of motion, so that's also a really good sign.
That's good. Thank you.
You're welcome. And now we're going to practice saccades. And so this is to see how you're able to move your eyes back and forth rapidly between two targets. And we're going to have to do this test 4 times in a way. So first we're going to do your horizontal movement. So you're going to look from one finger to the other finger rapidly. And you have to do it 10 times. Yep, just like that. You're going to do it 10 times and I'll tell you when to stop, okay?
Sounds good.
All right, go whenever you're ready. Okay. And now, go whenever you're ready. All right, very good. And go whenever you're ready. Good. And last one, whenever you're ready. All right, you're all done. Nice job. So those were your saccades, and that is also similar to what you have to do when you're watching hockey. So, you know, you might have been feeling a little fatigued at the end of those, so that's very similar to watching that puck move back and forth. And now we're going to do a test called accommodation. So I'm going to see how you do looking between these two markers when they're at different distances from your face, okay? So let's do it like that. So look from the yellow to the pink and go back and forth until I tell you to stop. All right, that looked really good. Did that feel okay?
Felt okay.
Felt okay? All right, you were able to focus on each one.
Yes, I was.
Good. All right, and now since you were having that left neglect, you were missing objects that were on your left, I'm going to do a brief midline shift test. So we're just going to silence your cell phone in the back. So we're going to do a brief visual midline shift test, okay? So you're going to follow my finger, and first we're going to do it from right to center, left to center, top to bottom, and bottom to top. And when I go from right to left, you'll tell me when I get to your nose, okay? Okay, so stay looking at me.
Nose.
Okay?
Nose.
All right, now we're going to top to down, and you tell me when I get to your eyes this time. Very good. So your midline is accurate. Sometimes when people have a head injury, their midline is off. And then this is the last test we're going to do. It's called confrontation testing. And so the way this works is you're going to stay looking at me again, and I'm going to be showing numbers in the periphery of your vision, and you're going to tell me what number I'm holding up, okay?
I gotta keep looking at you.
Yep, you keep both eyes open and you just look at me, okay?
Right.
All right, what number?
5.
What number?
4.
What number?
1.
What number? All right, very good. So you did really well on all of these tests, but due to the fatigue and the issues with your day-to-day vision that you're having, I'm going to refer you to both a neural optometrist and also to a brain injury specialist, which is also an occupational therapist like myself, but someone who has a little more training in all of this.
Awesome.
So thank you so much for your time, Jason.
Thank you very much.